Hi, this is Dr. Zafer. My patient said to me, Dr. Z, I want to explain something about stem cell treatment. At the stem cell treatment, we will take a 3 piece of tissue from back of the ears. We will apply the stem cell, especially the middle parts, also the front and crown area. We take a 3 piece of tissue from the back of the ears, and at this time you shouldn't feel pain. It will help your existing hairs will be more thicker and more stronger. Okay. Do you have any pain?
No.
Now I am taking the tissues and put into the kits. This is the stem cell kit. The machine will prepare the tissue for the stem cell treatment. This is using single, just one patient we use this one. The machine will cut this tissue very small cells. This machine will separate to the tissue. It will help the existing hairs will be more thicker and more stronger. Also the extracted hairs, we have some baby hairs. The baby hairs will be grow and will be more thicker with the stem cell treatment. It's ready. I will prepare. After that, I will inject. Now I am taking the tissues. Now we have 2 injections. I want to mix it for the homogenization. Your stem cell is ready. Okay, now I'm inject under the scalp. The stem cell effects will start after 1 and 3 months later, and the effects of the stem cell will continue 1 or 2 years. After 1 year, if you want, you can do again the stem cell treatment. If you need also, you can do the stem cell treatment 1 year later. Thank you.